Hello, hello, everybody, and welcome. We are here. All right. A couple of little tech glitches, but lo and behold, we worked through it. And bravo to Tanya. She is here with us today. And oh my gosh, this is going to be amazing. One of just an incredible topic for you today, guys. So I'm Lesli Bitel, business coach and mentor, and I am joined by the one and only Miss Tanya, otherwise known as the Lupus Dietitian. So we are going to take a dive into how to help lupus clients.
Yes.
Gosh, it's a great topic. I worked, in the clinical setting many, many years ago. And I remember seeing lupus patients in the hospital. And of course, back then there was, nothing unique about how we approach them from a nutrition standpoint. So I'm super excited to chat with you today, Tanya, about this topic. So to kick things off, tell us a little bit about yourself, your background, and most importantly, how did you land on this spectacular niche?
Yeah, thank you so much. Thank you so much for having me. I'm so happy to be here. And I have a very unique path to this. So I have been a registered dietitian a long time. I did my undergraduate and my master's in nutrition. So I knew this was my space. I really love it. I love helping people feel more empowered and more in control of their healthcare journey through their diet, their lifestyle, etc. So how did I get specifically to lupus? I actually have a lifelong history with a lot of autoimmune diseases. The first diagnosis I received was when I was 12, so very young. And unfortunately, if any of you have worked with people with autoimmune diseases, they like to cluster. So if you have one, sometimes you collect them all, unfortunately. Yeah. So through the years, I had had more autoimmune diagnoses and realized that while I thought I was doing a healthy diet, very much like a dietitian, 8 years ago, I was diagnosed with lupus. And so I kind of went back to the drawing board. Wait a minute. If I'm doing a quote unquote healthy diet and I still have this core inflammation as the root cause of my autoimmune disease symptoms and kind of these permutations in different ways, something I'm doing just isn't right for my body. So I looked at all of the research and implemented those things for myself 8 years ago, getting on 9 years ago at this point. And I found that I was able to put all of my symptoms into complete remission, no more flares. And sometimes I tell people that and they're like, oh, it must have been a mild case. No, my teens, I was in and out of the hospital in my 20s. At one point, I needed an organ transplant. Like my autoimmune diseases have been quite severe. So not to like make it sound dramatic, but to give that offering of hope for people that have struggled with really severe disease. There's still so much you can do with your diet and your lifestyle. So anyway, putting myself into remission, I realized in the last, let's say 2 years, wow, there's not good information out there for other people that aren't already a professional in the field regarding lupus and a lot of autoimmune diseases and diet. So then I really felt as though, wow, this is something that there's so many people that could benefit from just good information. And I put all of my efforts and passion behind helping people with lupus and other autoimmune diseases know just a little bit more about what they can do to help themselves feel much better.
Wow, what a journey. Incredible. Starting in your teen years. Yeah. That had to be really tough.
Yeah. It wasn't always fun.
Yeah. So I'm really thankful that your openness and sharing. So really want to express my appreciation for that. And for our audience, I want to just kind of give you a high-level overview of some of the things that we're going to delve into today. So we're going to talk a little bit about dietary changes that can help reduce the symptoms of autoimmune disease, how to create a personalized diet plan for your clients with these disorders, the benefits of a holistic approach to managing and, maybe even some tips to help your clients stay motivated. Right. So lots of really important concepts to share. Um, oh, great. So, oh, yeah, we hear from, hey, Bonnie, thanks for joining us today. Yeah, absolutely, truly amazing, spectacular practitioner and just person through and through. So, I feel really fortunate to have gotten to know you over the past year, Tanya.
Oh,
So,
thank you.
yeah. Great. All right. So you have a history yourself, a very significant history, and really the struggle began in your teen years, which then led you to really delve in and learn how to really better manage your own health. And it sounds like that inspired you to really put your stake in the ground around helping other people with this, specifically with this particular diagnosis. So tell us a little bit about how rare or how common is lupus in today's world?
Yeah, so I actually just Googled this yesterday to see if there's any updated information. It depends on who you ask in terms of the numbers. So, lupus.org informed me that there may be many, many people that are undiagnosed, but their quote for worldwide is about 5 million people with lupus.
Okay.
Um, but it is a bit of a tricky disease to diagnose properly, and I've even talked to a lot of rheumatologists. They say that the criteria for diagnosis is pretty stringent and that many people can present even years ahead of time. I believe that average time frame from the start of symptoms and actually getting the diagnosis can sometimes be between 4 and 7 years, so it's pretty long.
Okay.
um, they kind of have these lupus like diagnoses
Mhm.
where it may be mixed connective tissue disease or unspecified connective tissue disease, that sometimes people get before they meet all the criteria for lupus. Just as I mentioned, those autoimmune diseases, unfortunately, are all your immune system, and then the symptoms are not always clear as day in terms of, oh, you definitely have this.
Oh, okay. Can you describe, kind of just a little bit of background on what those symptoms look like? And maybe even for our audience, I'm not sure that everyone knows what lupus actually is.
Okay, so there are a couple different types of lupus. Discoid lupus affects the skin. So if anyone is a fan of R&B, the singer Seal, who was very popular in the '90s, has discoid lupus. So you may have remembered the scarring on his face.
Yes,
Um,
yes, yes. Okay.
yeah, yeah. Another type of lupus is just cutaneous lupus, so just affecting the skin. And then there's systemic lupus. So the abbreviation for that is SLE. So there are a couple different types, and there's actually even drug induced lupus or a very short term neonatal lupus that happens when a baby is born to a mom with lupus, and they may just have kind of that lingering autoimmunity, but not for very long. Many grow out of.
Okay, interesting. Is there one that's more prevalent out of all those?
SLE is the one. So unfortunately, the skin lupus, cutaneous lupus, some kind of often develops into SLE. So it transforms over time. The SLE or the systemic lupus is usually when people are seeing their labs very affected, and that's really when we start to worry about organ damage. But certainly, I mean, hair loss and rashes and scarring are very traumatic and very upsetting. So each type of lupus is really deserving of empathy and care, and the dietary and lifestyle changes can help with all of them.
Okay. Let me ask you a question about that.
Sure.
So, okay. I'm curious, does Western medicine recognize the power of nutrition in this diagnosis? Just
If
as
you,
a general rule, I
yeah,
know it really is gonna vary person to
yeah,
person, but
Yes.
what's
So
your experience?
if you have a excellent doctor, maybe they will dip their toe into, hey, there's some dietary or lifestyle changes that you can embark upon that may help you. But actually, one of my webinars that I did this past year was for a group of rheumatologists that had not looked into the research regarding diet lifestyle. And I am not saying this in a negative way because they have their niche. They are understanding all of the medications and that research, which is constantly changing. Thank goodness it is very different than it was 20 and 30 years ago when there were very limited options. So I would just say that many doctors don't speak about it. And it is let's say an opportunity for growth.
Gonna say that too. Like, we'll look at that in a positive way, in a positive light. Yeah, for sure. And, I'm sure physicians appreciate being educated on the power of nutrition as well in the specific diagnosis. So is it mostly rheumatologists then that
Yes.
that treat this patient type?
Mhm.
Okay.
Although very, very few people are primarily taken care of by their primary care and just see their rheumatologist less frequently.
Mhm.
It should be rheumatologists. That is their specialty.
Okay. And
Unfortunately,
yeah.
sorry, talking
No, you
just
go.
um, that there are many places in the country, especially like let's say very rural, where there may not be a rheumatologist for many miles. So thankfully, virtual care certainly has made that more accessible, but it's still a little tough.
Okay. Yeah, I'd be curious to know from our audience who here, or just tell me if you've had any training in your undergrad, your graduate school. I mean, where is this happening, right? I know I don't remember learning about it at all.
Yeah,
In
I would love to hear if anyone did. I certainly didn't. And I did an extra fellowship. I really went with it with the learning.
Right. Yeah. So if our audience can, regardless of whether you're watching us live, if you're catching the replay, give us a comment and let us know, if you have had any training in this area, or, I mean, was it ever brought up in your nutrition classes? I
Let's
honestly don't
see.
recall. I mean, honestly, it's crazy, right? Um, okay, so Lindsay says, nope, nothing she can remember. Hey Sharon, nope. Okay. All right. Yeah. So give us a comment, let us know. It's so interesting. All right. So how did you assimilate this? Like, how did you go about, really digging in and learning how to help these patients?
I looked up absolutely every PubMed article and any other research site where I could get access to scientific journals, research articles, research studies that had been done. And unfortunately, because it doesn't affect so. Oh, did we freeze? Are we back? There we go.
Yeah, you're back.
Okay. um, because it doesn't affect so many people. I mean, it's nowhere near on the scale of diabetes. Think about where the research money goes to, maybe not to lupus. But some of these studies were very interesting and done in the last 20, 30 years still can be very helpful. So I basically did a complete scientific research project of what information is out there that has some sort of strength behind it, if it was a good sample size.
Right.
Um, yeah.
Oh, so interesting. Let's see what our audience has to say. So Vanessa, I never learned about lupus specifically, but she did learn about autoimmunity in general and through her personal journey and later in the IFNA training. Amazing. And
Yeah, that is.
oh yeah, go ahead.
Oh, no, that's sometimes where people do get a little bit more of that integrative and functional medicine because it's looking at our body in a holistic perspective. And obviously, autoimmune diseases exist. So I'm glad that it is being included more often. And I'm sorry, go ahead,
Yeah.
Barbara.
Hey, Barbara, how are you? So good to have you. And Barbara says in her former position, she used to work with lupus patients.
Oh, that's amazing.
That's got to be really gratifying. And Amanda, welcome, Amanda, So Amanda has two autoimmune conditions. One was diagnosed when I was 19 by way of recurring DVTs. I'd love to learn how to put yours in or how you put yours in remission. Okay, let's start digging into that because my curiosity is very piqued at this point. All right, so why don't we start by talking a little bit about what kind of practice you have?
Sure. And one comment on Amanda's before I forget is that unfortunately, autoimmune diseases really affect women. Lupus is, let's say, for every 10 lupus patients, usually 9 of them are women, and one is let's say, with everyone's gender, someone that maybe identifies as a man, however we want to explain ourselves there. But it does affect women most often.
Okay, okay, got it. Okay, unfortunately.
Unfortunately, yeah.
Okay. And Jennifer said that she learned about lupus in the job as a renal dietitian.
That makes sense. So, actually, another fun fact, or not so fun, about lupus is that unfortunately, people that have systemic lupus and cutaneous, it can and affects about 30 to 50%. Thankfully, it is becoming less and less now with much better treatment options, turn into lupus nephritis. And as any of you are dietitians that remember your renal rotation, unfortunately, kidney function is one of those. It's once it's lost, it really rarely comes back unless it's just a very acute attack.
Right.
But yeah, so that's really scary, and that honestly does affect a lot of lupus patients and sends people to the dialysis center or for kidney transplant.
Mm. Okay. Yep, that is an unfortunate progression of the disease in some cases. Do you know the prevalence of that? I don't know if that is
The last statistic that I looked up was 30 to 50%. I don't know any hard and fast numbers of people or how many people, let's say, in dialysis centers are lupus patients. But again, thankfully, it seems like with better and better treatment options, hopefully earlier diagnosis, we can prevent people from going down that road.
okay. Okay, absolutely. All right, so tell us a little bit about your practice and then let's delve into, how you help those clients.
Definitely. So my practice is 100% virtual. I see people. Yeah, I love being virtual. You can't see it, but my pants are quite comfortable. Um,
I love that.
yes, I'm very good.
My workout pants on. So
Yes,
it's always, which is funny. It's like, okay, how's it going to look on Zoom? As long as
it's just on
like
top.
the shoulders up, right?
Yes, definitely. No more work slacks and the dry cleaner.
Right.
Not so often anymore. Anyway, so I do really, really love that flexibility. I mean, it also gives better access to patients. So, because I'm completely virtual, I am not stuck with the 50-mile radius of where I happen to live. Lupus is pretty disseminated. So, for example, an average rheumatologist may have a lot of rheumatoid arthritis patients and some lupus patients. So, even that is. It's hard to have lupus patients get the care they need and deserve. So I love that I can reach anyone, anywhere. I have clients from all over the world. The trickiest part is really just the time difference. How can we figure out if my time is 5 and you're at 3 in the morning? But beyond that, it really works. I mean, thankfully, video technology is so much better too, where we can clearly hear each other and see each other. But I love having a virtual
I
practice.
love that. And it makes me wonder if so before things became really easy to be virtual, do you think you would have had a big enough audience in this specific niche?
No,
You know what I'm
definitely
saying?
not.
So,
Yeah.
okay, yeah. So, it's a really interesting thing where we're able with the increased acceptance and availability and just ease of being able to be virtual. I
Yeah.
think it's allowed us to really niche down, right? So probably you, I'm just guessing, instead of really niching down into the specific area of lupus, perhaps you would have been focused on autoimmune, right? Maybe.
Yeah. But even then, it may not have been enough to sustain 100%. I don't live in a big city right now. So that also is that's really sad that if you didn't live in a big city, you couldn't have access to specialties like that.
I know it is. So there's definitely a lot of good things that, have come, certainly from just having these virtual platforms become more reliable and just better.
Definitely.
Okay, so you've got 100% virtual practice.
Mhm.
I know you see or clients one-on-one, and you've got some groups, right?
I do, yes. So I found that while one-on-one is absolutely excellent, there's only one of me. So also to give the option of groups allows me to reach more people,
Mhm.
and people really learn from each other. It's such an opportunity where if they didn't seek out, let's say, a lupus support group when they were diagnosed, and let's be honest, that's not how everyone functions. They
Yeah.
have these group calls now where they can learn from the experience of others. If I'm giving, let's say, 10 actionable items, no one person can do them all. But the next call that we have, maybe they tried one, the next person tried one, and they've all tried different things. And now they can speak to that experience or bring up any difficulties they're having. So they all can learn even more so.
Yeah. So yeah, as you know, I'm a huge fan of the group program. So I'm really pleased that you've been able to successfully integrate that into your business. It's awesome. Okay, so let's talk a little bit about how you help these people,
In
right?
so many ways.
True. Where do we start, right?
Yeah, yeah.
'Cause it's a lot, and I know you do nutrition, lifestyle. Um, where would you even begin?
Right. So, in my approach, of course, I can be the expert in some of the things, but I actually do also have guest experts come. I have a pharmacist just come and completely explain all of the medications, side effects to look out for, supplements that actually have good research behind them, supplements that aren't such a great idea. I have other special guests. Therapists on coping with the chronic illness. There is grief involved. There's that stages of grief where you feel angry and move on to acceptance. Also, stress management. I mean, everyone knows if you're feeling really stressed, you're not going to feel your best either.
And
Yeah,
and I would imagine that brings on increased risk of flares. I, I'm
100%.
I'm
Yeah.
guessing, right?
No, 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 you're right. Yes, definitely.
So
So that's a little, let's say, longer lifetime habits are addressed in stress management. And then I actually have another autoimmune warrior or a person living with autoimmune disease. And
huh.
she is a personal trainer. So she comes in and talks about exercise too.
Oh, okay. So is the exercise maybe different?
It's
Um,
yeah, that's a
girl?
great question. So it's not necessarily that moves are different. It's more that many people with autoimmune diseases, especially lupus, really struggle with fatigue. So they may have been inactive for quite a long time. And then let's say they get out of a flare, they're feeling much better, whew, and they want to get back into exercising. Maybe they were really active before their diagnosis
Mhm.
and push too hard. And then they can put themselves kind of down under again where they feel absolutely exhausted. So it's
Okay.
sort of tiptoeing their way back into regular exercise and how to escalate it slowly and gradually so they can see the benefits and feel the benefits without overextending themselves.
Okay. When are most women diagnosed?
Oh, great question. So it is usually during childbearing years is the old term for it. So like let's say 15 to I think 49
Okay.
is the time when people are most often diagnosed. Um, some of those diagnoses are around like hormonal changes. So puberty,
Okay.
pregnancy, menopause are some hot times for autoimmune flares and those symptoms to come up.
Okay. Interesting. All right. So, all right. Well, let's dig into your personalized holistic approach, right?
Yeah.
I'm sure our audience is sitting on the edge of their seat wanting to know, like, what do you do to help these
We
folks?
do. Yeah. So, kind of the broad strokes of things. So, lupus patients, obviously, we worry about lupus nephritis or lupus affecting their kidneys. If someone already has any sort of kidney damage, maybe stage 1 or stage 2, we're not really changing the recommendations so drastically for them. However, if they're further advanced, then we worry about the usual things. So, anyone that worked in a dialysis center definitely knows this. We worry about potassium, phosphorus, and sodium. Now, another risk factor, unfortunately, for many women and men living with lupus is cardiovascular disease. So, that kind of whole body inflammation really affects our cardiovascular health. So that's another big tenet of how I'm helping people is we're worrying about their cardiovascular health. We all know those recommendations too. That's a big chunk of nutrition education that we get. Of course, heart healthy fats, being careful with saturated or trans fats, the other sorts of things. Vegetables are always everyone's favorite. Lean proteins, etc. So those sorts of heart healthy recommendations, of course, being cognizant of kidney disease, and then looking for any sort of triggers for inflammation. And that can be a lot of things. Sometimes, and there's a phrase, I'm honestly not sure who said it, but you cannot get well in the environment in which you got sick. So,
Oh,
yeah.
interesting. Oh, wow. Okay.
So it's heavy. It's a big responsibility to take in to look at your environment and say, what of this is not assisting me? And then it could be, of course, diet and nutrition, that stress. I know a lot of people that get their diagnosis when they're going through a particularly stressful time in life, whatever that may be, a really challenging job, a loss, whether it's a family member, a loved one,
Mhm.
anything really.
Okay.
So those are certainly big pieces of the environment, but the diet. So things like dietary triggers, and we can think of all of the usual allergens. Those are certainly on the list. And then there's a shorter list that's very specific to lupus.
Hmm.
Alfalfa sprouts is on that list,
Oh,
right?
the triggers?
Yeah,
My goodness.
right. It is
Never,
weird.
never knew that. Never, ever have even heard that.
I mean,
What's
usually,
in it?
thankfully.
Like,
Uh-huh.
do you know, can you elaborate on that? Like,
Sure. And
what is it about alfalfa sprouts?
yes. I honestly butcher the pronunciation every time. I've actually practiced
Okay.
this by myself, but it's L-cannavanine,
Okay.
and it's a component in alfalfa seeds and alfalfa sprouts
Uh-huh.
that can actually trigger lupus-like symptoms in people that don't even have lupus. So the original study was a long time ago. They actually gave people alfalfa supplements, just essentially ground dried alfalfa, and
Yeah.
induced lupus like symptoms in some people that were prone to it. So that's something, if you already have lupus and you're consuming quite regularly,
Yeah.
will exacerbate those symptoms.
Okay. Okay.
Yeah.
Wow. Fascinating. Who would have known?
Right. And
Yes.
so if anyone's,
Yeah, I was going to ask, does anyone in our audience let me know in the chat if you had any level of awareness around that connection with alfalfa
or if you eat alfalfa sprouts often, it's
spray?
something that sometimes we aren't necessarily paying attention to, but it would be like on your pad thai or
Uh-huh.
pho sometimes. Sometimes it's bean sprouts, but it can be alfalfa sprouts too.
And can you refresh my memory? What are some of those? I know you said early on that there's a lot of different symptoms, which
Oh, sure.
makes it challenging in some ways to diagnose. But what would you say the most common symptoms are that people want to keep a lookout for?
Yeah, so this is why it's so difficult sometimes. So fatigue is up
Okay.
there. Almost everyone has fatigue, unless you're very well controlled and doing a lot of diet and lifestyle things. Fatigue really hits everyone hard because your body's essentially working on overdrive,
Mhm.
unfortunately attacking itself. So that's one thing that many people will complain of the most. There are some lab work changes. So the ANA is a lab that all the rheumatologists look for, but it's not very specific. So if it's
Okay.
positive, that could be lupus, but it could also be quite a few other autoimmune diseases.
Right.
Yeah.
Okay.
Yeah. Then they look at other labs like antibody labs. In terms of physical symptoms, it can be quite confusing because they have so much overlap with other things. Like you might have digestive distress, like kind of acid reflux, gas, bloating, diarrhea, constipation. So basically anything going wrong with your digestion. But what,
Okay.
I mean, that's very vague for people.
It is. It could send you on so many different paths.
Yes.
I
Yeah,
would
definitely.
imagine that by the time you get a diagnosis, I'm just guessing, like, I'm guessing most people have really been through a lot by the time they finally get a diagnosis.
Yeah. And then getting more specific and kind of more different for lupus, joint pain and muscle pain, joint
Oh,
swelling are very prevalent. Also, unfortunately, it does affect our heart. So, some of those, there's something called pleuritis, which can feel kind of like a stabbing chest pain. And so many. The quintessential thing that doctors really, I don't want to say love to see because no one loves to see
right.
someone be ill, but that is very, very lupus specific is the butterfly rash. So redness on the cheeks and
Oh,
nose. And that's
okay.
very specific to lupus alone.
And that is prior to treatment. So that's not a drug-induced symptom.
No.
Oh, interesting. Okay. Okay. All right. I must be thinking of I'm just in the back of my mind, just remembering, the moon phase, like the steroid,
Oh, for
you know,
sure.
from prednisone. Okay. All right. Yeah. Okay. I just got to ask my curiosity. What would the mechanism of action be for the butterfly rash?
So I don't know why it affects the face specifically. I mean, granted, lupus does affect people, their skin all over.
Yeah.
Hair loss is very common,
Okay.
kind of alopecia, and there's a lot of things related to lupus
Right.
and skin. But for some reason, it does come in that distinctive
Okay.
pattern to the lupus. Although I've seen clients before that it didn't present so cleanly. It wasn't just a butterfly, it was their whole face or their nose, like really specifically, or their cheeks specifically. But
Okay. So
essentially, yeah, that sort of rash is usually what doctors feel very confident. If that shows up, all right, the autoimmune thing that we're dealing with is lupus.
all right. All right. That makes sense. And is that treatable? I mean, is that part of the inflammatory response where if we can reduce
Yeah.
inflammation, that'll kind of go away, I hope?
So it's always if we can address that root cause of inflammation. So there
Okay.
are a lot more medications. Obviously, I'm a big uh, champion for the diet and the lifestyle. But once whole body inflammation goes down, then of course your skin takes a little while to heal. Certainly, hair takes a while to grow back,
Right.
but that can go away. It's not necessarily there forever.
Okay.
Hmm.
Okay. So tell us a little bit about, yeah, I'm curious about your elimination diet. And I think you say partial elimination. And we started to talk a little bit about that when you brought up the alfalfa sprouts.
Yeah.
So that's probably next, obviously, for people with this diagnosis or people who, you know, are symptomatic, right? And maybe don't even have the diagnosis. But what else? What else do you do in terms of diet, and especially related to the elimination component?
Mhm. So there are definitely some big things that we worry about. I did want to go over like the small strange things that are associated with lupus. So one is garlic, and I have found this to be very polarizing. Some of my clients do very well with garlic, and there's research studies on both sides, and
Mhm.
some people do very poorly with garlic. So that's another one to kind of keep in mind. And then another kind of strange one is yellow number 5. There is, yeah,
Wow.
What? Exactly. There's good research that
Perfect.
can affect lupus, and
Okay.
unfortunately, it's in a lot of things. So, I mean, anything colorful may have yellow number 5, especially those multicolored things.
Processed foods, right?
Processed foods, yeah.
Right.
Sometimes
So,
our medications,
oh,
sometimes
true. Okay. Meds as well. Didn't even think of that.
mhm. Yeah, so those are kind of the less often thought of things, but still important because if someone's consuming a whole lot of that, not great and easy to avoid. We can just get something else. You don't need that. Certainly doesn't have vitamins or nutrients. Now, the partial elimination diet, this is my approach with people. So I have found, and if you look in the landscape of what sort of dietary treatments there are for lupus, I will say that what you may find is practitioners, a variety of them, either recommending a whole lot of supplements, or there is a doctor, and she did one research study that recommends the raw food vegan diet.
Mhm.
However, as dietitians out there, clients are not always going to stick with a raw food vegan diet. That requires a lot of life changes and can be quite difficult and require a lot of time in the kitchen to have a well balanced diet. I mean, you could just eat fruit all day long, but you would not feel your best. So that's one thing that is out there. And I actually get a lot of clients that say, "Well, I bought this book and I tried it for 6 weeks, but I can't maintain this."
Right.
So yeah, then there's another diet that maybe some of you have seen. It's called the autoimmune protocol diet.
Mhm.
Yeah. So this kind of came from, like, let's say if we're talking about the evolution of things. Dr. Terry Walls is a doctor that has MS. She
Mhm.
came up with a little bit different protocol for autoimmune, particularly MS, and found great success with it. Then another doctor, Dr. Ballantyne, kind of came up with this. So the autoimmune protocol is an approach where you're eliminating essentially every single allergen and grains and different oils. It's a
It's
short
pretty intense,
list.
right?
I'm sorry, what did you say?
Is it pretty intense?
It's pretty intense. You really are limited on any sort of grab and go from outside because you even have to pay attention to the spices.
Oh,
Yeah, there are actually a few companies, very small companies, that are coming up with some like products that are autoimmune protocol compliant, but it's tricky. You really are doing everything in your kitchen on your own. So that one eliminates everything until you are asymptomatic,
mhm.
which could take a long time for some people. And then you start reintroducing according to their protocol. So, my approach with clients is okay, let's take some of these ideas and find how you can implement things the best for you and also not be so restricted, not have to prepare everything in your own kitchen, maybe be able to go out once in a while, still socialize, not feel isolated. So, from my initial assessment with people, I look at all of their medical history, everything that they tell me that they know they can't tolerate, that they do tolerate. And then I come up with a personalized plan for them. Oh, okay. From what you've told me, these sound like the 2 triggers that if we eliminate may get you the biggest kind of bang for your buck. And improvement in symptoms because of course people want to feel better right away, and if you're fatigued, if you have a lot of joint and muscle pain, people sometimes can't even use their hands,
So
then
hard,
how can you cook?
and you're so exhausted.
Yeah,
I mean, it's hard for normal people who don't have lupus, right? It's
exactly.
really hard. So add that in, that's gotta be really challenging at times. So, okay, so you really work with them to figure out where they're gonna get the biggest benefit
Exactly. Yeah.
and
And
what
I
they
mean,
actually can do.
exactly, too. So let's say I have my list of things I think they can do. And I'm realistic with them. What can you fit in your life right now? What is your bandwidth? Because if all dietitians know this, all practitioners know this, if you give them everything all at once, so many people would feel so overwhelmed and feel as though, oh my goodness, I can't implement all of this. So you have to use your professional judgment of,
Mhm.
okay, what is the most important thing that will get you feeling your best as soon as possible? Then we can approach the others.
I love that. That's so smart. We have a question. I think this is a really
Great.
good one. Amanda, I love this. Thank you for asking. So Amanda's wondering if you do any kind of food sensitivity testing.
Great question. So I've actually found if people are in a super inflamed state that they'll get everything as a sensitivity. One person came with the test, and it was nearly every food was you're
Gosh.
sensitive to this because they have so much inflammation,
Yeah.
especially it's become much more talked about in media, but leaky gut and that sort of dysbiosis, all of these things that are in our digestive system also interacting with our immune system and our autoimmunity. Sometimes those tests, unfortunately, aren't so helpful at the very beginning.
Got it. Yeah. Then they get these results and what a disaster, right?
Exactly. They
Yeah.
feel really upset and
Yeah,
a
rightly so. I
yeah,
mean, I understand because then they're like, "Oh my gosh, what there's not I can't eat anything." That
right, and very dejected. They don't know where to go from there. I mean, if you told someone, okay, here's 80 things that you can't eat, I would give up. I would say, forget it. I don't know how to work around this.
Mhm. So do you pick like, I'm just curious about then. I mean, some of the things that you're recommending to avoid, like alfalfa sprouts, things like that. In your practice, do you say like, let's get rid of gluten, let's get rid of dairy, like some of those, I guess, thought to be inflammatory types of food groups?
Yeah, definitely.
Okay.
And to assess where people are too, I
Mhm.
ask them to fill out a food and symptom journal. So then we're getting that constant communication. Oh, I ate something with this trigger food. I got a headache immediately after diarrhea that night. And then we say, all right, well, maybe that's not such a great choice for you.
Okay. So keeping a food log is a huge part of
Yeah.
your approach. Okay.
Yeah, and we really get detailed with that log. So we talk about bowel movements, we talk about symptoms, joint pain. I
Mhm.
ask them to fill out the severity of that symptom because, again, so much is subjective. Maybe you wake up one day and the joint pain is like a 10 out of 10. And
Mhm.
then a week later, hey, we got to a 6 out of 10. That's a huge improvement. But if you didn't write that down, sometimes it can be a little bit fuzzy to realize, oh, wow, that's really improved quite a lot.
Right. Oh, yeah. Yeah, because I do remember those days where it's like, this is the new normal, and people kind of forget,
Yeah.
like, how they showed up, right?
Mhm. Or
You
the
know
frequency too, like, oh, well, for example, I had a client that her food insensitivity, her reactions were so strong that she would actually vomit sometimes. And even though it's a very distinct memory, maybe you forget, oh, wow, I was doing that once a week. Now I'm doing it once a month. And when we're done working, oh, wow, I haven't in 6 months.
Okay. Yeah, that's huge. I'm curious about how are you going about finding these clients? Tell us a little bit about that. So, unless there's anything else you wanna share in terms of your approach.
No, I think we covered it. I mean, certainly, we talk about the general things, sleep. We do talk about supplements. Talking about in terms of removing in our environment any sort of inflammatory things. I mean, there's a good amount of research. We know that BPA is an endocrine disruptor. Those fragrances that are in things, kind of our chemical laundry, cleaning products, even makeup. I mean, we're
Mhm.
literally putting that on our lips. How much of that are we eating? So it may be worth buying, let's say, the product that's using all natural ingredients versus a lot of, let's say, preservatives, chemicals, colorings, etc. So that's something else I address with people. But yeah, I think we covered everything else.
Okay. Okay. So yeah, how do you find these clients? Tell us
Yes.
a bit
So
about
the wild, wild west of the social media world is where I live. And I try also, I am at the Lupus Dietitian on everything: Instagram, Facebook, TikTok, YouTube. I try to put great educational information out there. So let's say someone is not 100% ready to even make changes.
Mhm.
I am constantly posting educational information from lupus nonprofit organizations, research organizations, anything that I can put out there that may be helpful for people, is how I have set up all of my profiles. Tips that they can implement, very, very small things that anyone can kind of pick up. And hey, if they incorporate that one thing, maybe they feel a little bit better.
Love that. So yeah, so it's putting useful content out in the world, right?
100%. Yeah, yeah.
So you mentioned early in our conversation about doing a talk for
Mhm.
a group of physicians. So is that tell us a little bit about that because that's one of my favorite strategies. You know, do educating other professionals, and then you've got like a group of referral partners, right? I
Yes.
love that so much. So can you share a little bit about honestly, how did you go about getting that set up? Because it can be a little bit daunting for m- some people in my audience, quite frankly, especially, I mean, it's just they don't really know where to start sometimes. So if
Yeah.
you wouldn't mind indulging us a little bit, that would be so helpful.
No, I would love to. So, also just talking about sharing to other professionals, I have another talk scheduled with dietitians. So, all of you practitioners out there, please continue to refer, because it is so helpful. And if the doctors don't know what to do or don't have the time to do, they're happy to refer. So, it's so important to just put your name out there.
Yeah.
Now, in terms of how I went about it, I go to all of the lupus related conferences in my network. I introduce myself. I mean, the topics there do touch upon nutrition, so you already have the common ground to have those discussions. Oftentimes in these conferences, they have so many opportunities to chat and network with each other. Now, for let's say someone that has a brick and mortar shop and is defined by a locality, just outreaching to your doctors that are in your area can be a fantastic way. Again, they don't have much time. They want to just say, here, go see this other professional and
They
figure it
want
out.
to trust that person. So I think that's maybe where the challenge lies. So, all right. So here's the question. I'm going to try to pin this down a little bit. So when you reached out to your group of physicians, how did you do that? Like, did you call? Did you email? Did you talk to the office manager? Like, I know I'm being really specific here.
No, that's fine. That is, I mean, this is helpful for people.
Uh-huh.
So I met a physician. This was a rheumatology conference. So they were all rheumatologists. I met a rheumatologist there. I was explaining how I help people. I was giving examples. And she said, oh, this is fantastic. Why don't you come speak to my group of physicians? We meet once a month. We would
Right.
love to have you. And it's all virtual for me. So it was an online webinar, very easy logistically to organize.
Oh, I love that. Okay, so the moral to this story for everybody, I think, is look for opportunities, go to conferences where potential referral partners are present, right? I think
Definitely.
that is a really, really smart idea. Um,
Also, talk
yeah,
about yourself
yeah,
because no one's going to know what you do or what your specialty is if you don't express that. Let's say, for example, you're a weight loss dietitian or a diabetes dietitian. Now, these are more general topics, but if everyone around you in your community and your circle and everyone that you meet knows, oh, she's a diabetes dietitian, then anyone they meet with diabetes, they'll say, hey, I have a diabetes dietitian. So uh, you have to be your own, let's say, marketing team,
yeah.
unless you have one. But
And even
just
then, no one can do it like you.
right, exactly, exactly.
'Cause you're the
You
one
have to
with the
talk about it.
passion, right? You're the one. Yeah, your marketing team, if you even have one, I mean, it's great, but they don't have your language, your passion. I would say that's probably the biggest part,
Mhm.
and I think that's a good reframe for thinking about self-marketing
Mm.
is it's really I've always felt so strongly it's not about, I don't know, tooting your own horn kind of thing. It's just more about how you can help other people and your passion, letting people know that you want to be able to help more people. So many people out there are struggling, and you're here to serve. I mean, really, if you put it in that context,
Mhm.
I feel like marketing yourself becomes much more comfortable, much more palatable, right?
Exactly. Yeah. And then I think on the social media side of things, if
Yeah.
you are providing educational content that already has innate value, then
Mhm.
people are so happy to refer others to your page, to
Right.
your content, and then they can like, know, and trust you more.
Exactly. All right. Wow, time flies. So I want to thank you for spending all this time with us today. Incredible.
Thank you
Absolutely
so
love
much for the
every
opportunity.
minute.
I love chatting with you.
Oh, well, we have to do it again then. But before we go, would you like to share? Can you share any more info about your webinar? Because I'd love for my audience to support you if at all possible.
Sure. So, um, in terms of anybody out there, if you have any lupus patients, surely send them my way. Actually, another talk that I'm doing in the coming year is to a group of dietitians so that I can really get into the nitty gritty and
Okay.
show people. I am happy to speak on any topics. I do online webinars all the time for nonprofit lupus organizations. And I think for everyone out there, just to speak to actionable items that you can do is not only that self marketing, but also just establishing yourself in your own little niche, in your own corner of the world, and being really passionate about that and framing it in that way. I'm here to serve others. I'm here to be helpful. I think really, really carries that message far and wide.
Love that. All right. All right. Sounds good. So, thank you again, Tanya. Really appreciate your time. Thanks to everyone that joined us today and those of you that are going to listen to the replay as well. So, really appreciate you having me along in your journey. So, all right, guys. So, next week is Turkey Day, right? So, um, we won't be going live that day. So, we will see you the following week. All right. All right, guys, have a wonderful and safe holiday. Thanks again, Tanya, and I'll see you again in a couple of weeks then. Bye, everybody.
Thank you, everyone.